Dementia is a serious condition that not only makes life difficult for patients, but for their family members as well, as around-the-clock care is required. To help those in need, the government has rolled out a new policy to help lessen the burden on patients and their relatives. For more on the policy and how it's being received, here's our Oh Jung-hee.
그 여자 울면서 나갔어. 아빠, 더 이상 이런 식으로 하면 안 돼.
내 시계를 훔쳤다고?
아빠 시계를?
그렇다니까.
혹시 아빠가 잃어버린 거 아닐까?
기억이 안 나. 시설로 모셔야지.
요양원?
그래, 요양원 말이야. 그게 아버지한테 훨씬 좋을 거야.
This is part of a play called lessen. It depicts a problem seen often in our society, family violence and conflict related to dementia. President Moon Jae-in has called dementia something that everyone fears, and his government has vowed to find ways on a national level for people to cope with it.
전국 통틀어 47개소에 불과한 치매안심센터를 252개로 늘리는 예산을 배정했습니다. 치매 상담은 물론 조기 검진을 통해 치매를 예방하고 환자와 가족의 부담을 줄여드릴 것입니다.
One such center is the 노원구 District Center for Dementia in Northern Seoul. Alongside dementia screening tests, it also runs daily classes to prevent the condition in both high-risk and normal groups and to delay the progression of the disease in those who already have it. Patients come here every day for checkups and to engage in activities like exercise, crafts, games, and cooking.
What we call cognition refers to the process of a stimulus coming into the brain and the brain thinking of how to respond to it. But patients with dementia have difficulty doing that. So our programs help patients activate their brains through continuous stimuli.
One district resident has had her 80-year-old mother enrolled in this class for a year. She says she was lucky to get her in because the programs have helped a lot to alleviate the symptoms.
My mom couldn't keep track of the date, but the instructors here always check the date with the students. It's not something I can do at home every single day. Also, activities like making things and coloring all stimulate brain activity. I think that really helped in improving my mom's memory.
In addition to centers like this one, the government hopes to expand dementia specialized clinics in public hospitals. It has also vowed to expand the national health insurance coverage to pay for 90% of dementia expenses and expand long-term care coverage to patients who have mild symptoms. All this to deal with the rapid rise of elderly dementia patients. The number of people 65 and older with dementia has increased by over 30% since 2012, now numbering over 725,000. That's 1 in every 10 senior citizens. The number is expected to top 1 million in 2024 and hit 2.7 million in 2050.
According to statistics, if we delay dementia progression by 2 years, we can save 20% of the socioeconomic costs related to dementia patients. So spending more on dementia is not a big loss. In fact, it's rather cost-effective. Apply that to the 2.7 million dementia patients in 2050. Now is the time to invest in dementia treatment and prevention.
But some parts will have to be improved to make this policy even more effective for treating dementia.
It's important that it be closely linked with primary health care. There are doctors in local communities treating patients with high blood pressure or diabetes. It'll be a great help in preventing or delaying dementia if they can refer patients to affiliated hospitals for dementia testing.
This policy will have to be broken down further because dementia has a lot more stages than we think. There aren't enough facilities for patients with mild symptoms.
Overall, the introduction of this new policy, where the national government takes the lead in providing support for dementia patients, is expected to bring about change across multiple fronts by changing perceptions, providing better treatment, and lessening the financial burden. Oh Jung-hee, Arirang News.